One of the areas that ties closely to insulin resistance or metabolic dysfunction is weight gain. And this is one of the symptoms when we start to become metabolically unhealthy. Other than what we've been talking about today to regain metabolic health, somebody who's been struggling to lose weight, they have a lot of extra fat on their body. We talked about visceral fat, so this could be visceral or subcutaneous. Any additional recommendations for somebody that has weight to lose?
Yeah, always think thyroid. Because to access our fat in order so we can mobilize that fat and move it to the liver where it can be converted into ketones, we need thyroid hormones. So if you haven't got the thyroid hormones to mobilize fat, then we mobilize fat with adrenaline instead. And adrenaline is very uncomfortable. That's what makes you feel wired but tired. So it is a feature of people who have an underactive thyroid. They tend to gain weight. And conversely, somebody who has an overactive thyroid, they're mobilizing so much fat that the weight just drops off them. So if somebody's really stuck, then again, think thyroid. And the important point to remember is that blood tests alone are never definitive. What blood tests do is they tell us if there's biochemical scope for a trial of thyroid hormones. Because population reference ranges are very different from our individual reference range. Fascinating paper in The Lancet published some years ago that took normal people and just measured the level of T4 and T3 in their bloodstream every month for 6 months. And what they demonstrate is that we all have our own personal reference range for a free T4 and a free T3. So although the population range may be 12 to 22 picomoles per litre, some people function best at 20 to 22, some people are running at 14 to 16, some may be running at 11 to 13. And we don't know what our own personal reference range is because nobody gets tested as a teenager to see what it is. So if the blood test shows that your free T4 or your free T3 is right at low end of range, that tells us that there is biochemical scope for a trial of thyroid hormones. And for this, I use a food-grade thyroid glandulars, which you can get online. You don't have to have a prescription for these. Start with a very low dose and build up. And in parallel with that, look out, have you got any other symptoms of underactive thyroid? The classic one is your pulse running slow. We should all know how to measure our pulse, and the pulse at rest should lie between about 70 and 75 beats per minute. The athletes are a bit slower, but that's average. So if your pulse is consistently slow, your core temperature is low, and you're fatigued, your brain isn't as sharp as it should be, you've got edema, maybe a slightly swollen face, voice changes, carpal tunnel syndrome, poor quality hair, loss of eyebrows. These are all symptoms that you might have an underactive thyroid. And very often by getting the thyroid up to speed, then suddenly that kick starts, you can start to lose weight because you are able to fat burn. And the other thing that often helps is sometimes you have to do a slightly longer fast, maybe a 36-hour or a 48-hour fast. And that really kickstarts the metabolism of the body. And suddenly the body wakes up, crumbs, we've got to get into fat burning mode, otherwise we're just not going to survive. So those are the two very useful tips that can often, kickstart the whole business of weight loss, if that is indeed a problem. But remember, upper fermenting gut, because that puts us in weight laying down mode. And again, any amount of fructose will stop you burning glycogen and is just switches off the whole business of being in ketosis.
You don't fear fat. You're all about eating the whole animal. But when it comes to weight loss specifically, how do you feel about people including extra fat? Say the butter on the steak, or putting butter in the coffee. Oftentimes in the keto carnivore world, those things are promoted to get extra good quality fat. But how do you look at that in general? And then for somebody trying to lose weight?
Okay, well, a very useful tool is MCT oil, medium chain triglycerides, because even if you're not particularly fat adapted and running on ketones, they require no digestion. They're absorbed, as MCT oil. They go straight to the liver and generate ketones. So if you're feeling, you need that little hit of energy, or you're feeling hungry and you haven't got, the brain's not working, then MCT oil would be a perfect solution, because it's not going to go to fat. It goes straight to ketones, which you then burn off. And those ketones will stimulate mitochondria to go faster, and they also stimulate the growth of more mitochondria. And as you know, I think of mitochondria as the engines of our car. So it gives you a bigger engine that then goes faster. It's a bit expensive. That's the only trouble. But MCT oil is a very useful trick to help if you're trying to lose weight and maintain energy levels.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
For insulin to work, it's got to have some essential cofactors. Things like chromium, carnitine, vitamin B3 and vitamin B1. We can have insulin resistance because the insulin receptor is blocked.